Thank you for joining this evening, and we have an interesting guest on the phone. And I'll have to tell you, when I first called Dr. Cindy Hall from Glenwood Springs, Colorado, we had a quick chat, and I had looked at her resume, and it was quite interesting. Dr. Hall, you're there. Welcome.
Thank you, Ken.
You know, as I looked at your resume, it was quite interesting to follow. The first thing I noticed is, of course, you had studied in Boone, North Carolina, which is also kind of a mountainous area in the Appalachians, part of that. You had done some undergraduate work there. When you finished school...
Gone to osteopathic school, so I'm a
DO. School.
Yeah.
That's it, sorry, DO. And after finishing that, and then after that particular study, you decided to specialize in OBGYN, where you just mentioned I'm now delivering babies, correct?
Yeah.
And in female medicine.
And other parts.
Babies and other parts.
GYN surgery, and yes, GYN surgery as well. So.
Okay, good. And I noticed in your, when of course I made notes when you and I spoke, that you are also involved in the hormone replacement with women going through the different stages of life. And I think you're the one that was interesting enough to say men and women are just different as we continue to talk about the hormones and some of the different issues that women must go through on a monthly basis.
Yes, yeah, and it gets harder as we get older.
So let's start talking a little more about Somaderm and NewuULife, and just tell us a little bit about how you were introduced to it and what you saw that it might be able to do for you and your practice and some of your patients.
My friend Pauline, who was introduced to it, called me up and said, "You need this. You need to try this. You need to do this." And I was like, "What are you talking about?" And she's like, "It's homeopathic and it's a gel, and you can't get it right now because it's on back order." And, of course, that just made me want to do it more. So I was one of those people who joined early July, and I had to wait till the end of August to actually get my first bottle. And I was so excited about it. And it was a big buildup for all of us, and it did not let me down.
So what intrigued you when your friend told you about it? What was it that caught your eye and said, I've got to try this. This is something I'd like to use myself?
Well, you kind of mentioned how I'm a student of hormones, and for the past decade I've been doing hormone therapy with women, and I have been doing special studies with that. And I specialize in actually doing bioidentical hormones, and part of that study was looking at human growth hormone. And when I saw the benefits of human growth hormone, I was intrigued. But when I saw the problems associated with it, it was a real downer. And at that point, I knew that it just wasn't going to be part of my practice until it became different, safer, more accepted, something, because it just came with too many side effects, too much cost, and too many issues. You know, somebody having to inject themselves. It was just like, no, that's just not going to happen. So in my mind, I thought, this is good stuff, but it's just not ready for prime time, and I'm not ready to do it. So when I heard about the gel, and I saw that it's homeopathic, which I'd had experience with homeopathic medicine before I ever went to medical school. You know, I was intrigued by it and said, you know what? Nothing ventured, nothing gained. So I went ahead and plugged down the money and got a bottle and started seeing what was going on with it. And I was.
You mentioned that it didn't disappoint. What did you see that you were thrilled with? What were some of the responses that it gave you?
Well, I got to tell you, the things that people have posted on Facebook and in YouTube and that sort of thing, it's all true. Everything that everyone's saying is there. And I think the first thing that I noticed was the sleep, how clean the sleep was, how easy it was to apply this. It was just, you know, really cool, especially when right now the whole market is flooded with things that you have to drink or swallow or whatever. This is so easy compared to other things. And I got to tell you, one of the number one problems I see in my office is people complaining about their lack of sleep or clean sleep. And so when I can recommend something that is safe and natural, I will do that over any kind of prescription drug. And so this is the first thing that I saw. That to me was super impressive because right now everything that's out on the market comes with a slew of side effects and problems associated with it.
Fascinating. So you and I spoke for a little bit, as I mentioned before, and you said something fascinating. You said as you started sharing it with some of your patients or clients, you said that often some of them didn't get the very same reaction you got, but they got even something different, and you made the comment that something is good. Would you like to explain that? If it's doing something, something is good?
Oh yeah. Okay, so that's actually a double-edged sword, actually, because sometimes you can have a little bit of a reaction to the gel that isn't necessarily what you want. So like the first day I used the gel, I put it on right before bedtime, and I was wired all night long. I couldn't sleep. I was like, this is like an opposite reaction to what everybody's saying on the internet. But it was obvious to me it was working because this would not have been a normal night for me. So I knew something was working with the gel and that maybe it was a detox kind of situation for me. And I just tapered my use according to what I thought was going to work, and it worked great. And then the other part of that, Ken, is, people, I think the gel is intelligent. I think that what happens is in this homeopathic realm, we have to trust that the gel knows exactly what the body is needing and goes there and supplies that need. So it finds what this person needs. If it's something like they have anxiety or if they have something else, it comes in and it comes and focuses in that problematic area. And so I believe in that it does what it does because it needs to go there. But the first couple of days, it might not be exactly what you expect, but it is doing something. It kept me awake pretty much all night that first night.
Well, we're happy that, and as you suggest to others, you got to kind of figure it out for yourself. I mean, you take it as prescribed, watch what goes on, and then figure it out, because that it's doing something, as you said, is great news. Now let's just figure out how to fine-tune it for your own use. Would that be a correct statement?
That is accurate for what I'm trying to let everybody know, is that it is very individualized to the person and what their needs are.
So share with us a little bit. You've certainly shared the product in your practice, and you're watching your patients and clients very closely, I'm sure. What are you seeing, and what are you doing as follow-up with some of those that you start the Somaderm gel on?
Well, I'll tell you, I have been following women. We do annual exams, which, has a number of different screening tests that we do. And one of them is a depression questionnaire that is a tool. It's called the PHQ-9. And I'm actually seeing people's scores get better with that. And so this is, something that I'm documenting. I'm also doing blood work. So I am a very aggressive thyroid physician as far as maintaining thyroid health. And that was another intriguing part of the gel, was the thyroid and the adrenal, the adrenal components of the gel. I wondered how this would work for women with Hashimoto's disease. And I have a patient that has been on the gel now. She's into her 4th month with it. And I actually ran labs on her to see how she was doing with the gel. Now, her personal story is she's never felt better. And I've known this woman 30-some-odd years now, and last time I saw her, I looked at her and said, oh, my word, it's working. You could just tell by looking at her that her energy was different, her skin was different, just her presence. She looked younger. And so I did the blood work. It came back balanced, and we had not seen that before. With Hashimoto's, it's constantly chasing and chasing and chasing with, supplements and thyroid medication. And this was the first time that it had been balanced. The other thing that had happened with her is that she's menopausal. She won't mind me saying that, and she knows it, and she's suffered with it. And we'd also been chasing some of her hormone levels for her female hormones. And without changing a thing with her female hormones, they came into balance. So I didn't have to do anything. And we were like both raising our hands up going, yay, it's working, you know. So it was really eye-opening for the two of us. And she knew it. She could feel it. We just documented it.
Wow, great story and great facts. Any others that you've seen with interesting responses to the Somaderm gel as you've issued it out to your patients?
Well, I had a patient come in crying, just crying her eyes out. She's like telling me how she can't sleep, how she's so anxious. Every little thing just scares her. It puts her into a tizzy. Her brain won't stop, circling around through problems, worries that she had. And she was asking me for some medication for her anxiety. And at that point, between the anxiety and the inability to sleep, I asked her straight out, how do you feel about homeopathic or remedies, I should call it? And she said, I really would prefer that over any kind of medication or pharmaceutical. And so I said, let's try this out. Within 10 days, she called me and said, this is amazing. My life is so much better. And she's sleeping through the night. Her symptoms are resolved. She couldn't believe her good luck and just talking with me about this. But I will tell you one thing. As a physician, there's still the people who don't believe in the homeopathic medications or remedies, and I have to take that step to engage them in this and say, hey, how do you feel about this? Would you be willing to try this? Is this something that, appeals to you? And when they say yes, I feel like they're buying into it, and she bought into it, and now she is super happy about her results and her life. She's got her life back.
Wow. And I'm sure you've got more and more stories, and we're going to save some of those, Dr. Al. This has been a fascinating discussion with you this evening. So as you have kind of looked into it, besides where you're saying that, hey, we're seeing that it's doing something, have you found any negative side effects in any of the patients that you've been on that weren't easily corrected by just adjusting the dosage?
No, I've not seen any problems. Not really. Nothing that we couldn't fix by saying just try half tonight, half tomorrow, and then go back to a full pump. And it actually resolves very quickly. I haven't seen anything that's lingering.
Wow. So I would assume in an overall, you and I, of course, have spoken a few times over this, an overall expression of your excitement of this kind of product available to you. If you could just say something to our listeners tonight, what would be the overall message you'd have of them or anyone who might be listening that a distributor has got on the phone this evening to listen to you explain it? What would be your message to them as far as getting on the gel, making a commitment to do it? You and I kind of know that hormone therapy is not, even though you've had some overnight successes, the long-term use is always more beneficial. Would you like to share that with our listeners?
Yeah, well, twofold on this. I'd say that you're doing your friends and your family and the people that you are engaging with a disservice if you don't share this with them. But in the same vein, if you're going to share this with them, it's for the long haul. At 6 months is when people are starting to see big changes, big differences, muscle tone, energy levels, changes in their hair, changes where people are walking up to them and saying, you look really different. You can't just do 1 month and say, it didn't do anything, or, that's a really expensive sleeping gel. You can't just call it at 1 month. You have to get a commitment out of people to try it for the long haul, seriously. And I don't see myself ever getting off of the gel, to be honest with you.